The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hey everybody, this is Jonathan Marks from Go to Health Media. How are you today? I hope everything's going well. Remember, you can subscribe to us at gotohealthmedia.com so you don't miss a show. You can also watch us on YouTube and listen to us on 8 podcast networks. And you can also visit our new online store at gotohealthmedia.com/store, where you can buy Go to Health Media and I Support Evidence-Based Medicine swag for your enjoyment. So on to today's show. America is facing 2 huge crises in its healthcare system: the primary care shortage and the general public's diminishing trust in healthcare professionals. Colleges of osteopathic medicine are leading the charge to meet this primary care shortage challenge. In fact, these colleges have long been at the forefront of this issue by emphasizing core principles of primary care as they train future physicians, a mission embedded in their philosophy since 1874. Further, the 10 medical schools with the highest percentage of graduates practicing primary care are all doctors of osteopathic medicine schools. The American Association of Colleges of Osteopathic Medicine, that's AACOM, wants to address these issues and bring back a holistic approach to healthcare. Osteopathic doctors, or DOs, are trained to look beyond symptoms to understand how lifestyle and environmental factors impact well-being. If you want to learn more, you can visit aacom.org. Dr. Robert Cain is the President and Chief Executive Officer of the American Association of Colleges of Osteopathic Medicine and is our guest today. Before assuming this position, he served as the Associate Dean for Clinical Education at the Ohio University Heritage College of Osteopathic Medicine. He has received many awards for his contributions to osteopathic medical education. As a specialist in pulmonary medicine, he is board certified in both internal medicine and pulmonary medicine. And again, if you want to learn more, you can visit aacom.org. So welcome to the show today, Dr. Robert Cain. How are you today?
I'm doing great, and thank you for having me on.
Good. So the first question I want to ask, Doctor, is what's the difference between a DO, a doctor of osteopathic medicine, and an MD, a medical doctor? What's the difference?
Well, I think that's a great place for us to start, actually. So it's certainly still some confusion out there, so a chance to work on that. So when you are looking at a physician and noticing their name tag or their white coat, you may see either the letters DO or MD on that coat. So DO, Doctor of Osteopathic Medicine, MD, Doctor of Medicine. Importantly, for the patient, both are fully trained physicians, full spectrum of medical and surgical services available, unlimited licenses to practice in all 50 states in the United States. But only one of those 2 degrees, the DO degree, is actually built upon a very specific patient-focused philosophy of practice. And that philosophy emphasizes whole person care. So the idea we have to take care of mind, body, spirit together, prevention and health, supporting the body's own healing abilities, so the intrinsic mechanisms within us that help us to heal and maintain health and how we can support those. And then also the use of manual medicine manipulation as part of a way to address health and certain disorders, particularly those that involve the musculoskeletal system, the bones and joints. So those are the things that separate and make us unique, as well as where and how we train. So our schools are not, for the most part, focused on being part of academic health and research centers, those large research centers where they concentrate lots of medical students. We put our students out into hospitals across the country in community settings so that they're learning to train in the places we ultimately want them to stay and practice, and that we can try in those spaces to emphasize the importance of certain fields, like the primary care fields and some of the primary specialties like general surgery, psychiatry, and so forth. Really areas of need to create more of a healthcare system instead of a disease care system.
Wonderful. Thank you. Can I ask two more detailed questions about that? When you talk about manipulation, are we talking about chiropractic or what's the approach there?
So chiropractic arose in the US a little after the time that osteopathic medicine is actually founded in the 1870s. And while I would have to say there are similarities between how it's focused, chiropractic is limited to the use of manipulation and non-pharmacologic, non-surgical treatments to deliver its patient care. So it has a value and a place in the healthcare system. For us, it's integrated into the thought process of how we care for a patient. So I was a lung specialist, a pulmonary specialist. So imagine a patient on a ventilator. Not only was I using the same drugs to potentially treat their pneumonia as my MD colleagues, I would be using running and managing the ventilator to be able to support their respiratory status. But I was looking at how does their chest wall, how does the muscles, joints, and bones of that actually affect their ability to come off that ventilator and breathe on their own, and using manipulation within the context of a much broader, much more complex healthcare plan.
Got it. Thank you for that. And the second question is, when you talk about holistic medicine, what's the basis behind the holistic medicine? Are we talking about Eastern medicine?
So holistic in this case is mindset. And that's why I also use the phrase whole person care. So the idea that we can't separate out body, mind, and spirit as we care for the patient. So again, back to just using my own field, if a patient presents with shortness of breath from lung disease and all I do is focus on that lung disease itself, what am I missing in their environment, their home life, other aspects of their life experience that if I don't address or understand, I may not be able to get the same outcome for them or to get them to the highest functional state possible.
Got it. Thank you for those explanations. That really helps. So let me get to today's topic. So why is there such a shortage of primary care physicians?
We've really seen decades of transition here as the rise of specialization started in the US. And so if we sort of look at the drivers at the moment, we've got an aging population. So the large boomer population has reached a point that their needs for healthcare are increasing significantly, and a lot of chronic disease management potentially in that space. So we have more need for that front line of care. We've had some retirement numbers that occur every year related to primary care. So as people leave and the increasing demands are there, and the interest for students, we have to work to keep people moving into primary care. So there's an imbalance, right, between supply and demand really there. Well, why does that happen? Part of it, if you're a student either looking to become a physician or you're in medical school, one of the things you learn quickly is that, primary care physicians aren't compensated as well as specialists, and which is, completely unfair given the workload associated with both. But it's the way the system has emerged. And if you're deeply in debt, as most medical students are, there's always that question of, well, how am I going to take care of that debt? So kind of a natural driver there that can affect the thought process. Work demands. It's as difficult, if not more difficult, to operate a primary care practice versus a specialty care practice because anything could come through your door at any time in a primary care office versus the more narrow types of things you'll see in a specialty practice. Lots of administrative burden. And the last two quick things, the field, sadly, is not as respected. It's underappreciated for the important work that it does. And oftentimes that sense of, well, I want to be valued. I want to, I want the knowledge and things I've learned. And that may drive the choice as well. And then at the system level, our government and the third-party payers clearly have not created a system that values primary care, even though they say it's important to them.
And then the second crisis we've got, why does the general public have a diminishing trust in healthcare professionals?
I think this, just like the last one, begins with the slow changes that have taken place in the healthcare system from small business, solo practice types of practices where the physician's time was theirs and the ability to create the types of relationships they wanted, where that trusted primary care physician or general practice physician referred to trusted specialists. And all of that allowed like a transition of trust to occur. That as we move to a more corporate model of medicine, the person you're referred to, your physician may not know. That affects trust. Your physician may not have given you the time to really make sure you were heard and developed a good relationship. That affects trust. And then in recent years, because of the pandemic in particular, I think we saw a more rapid erosion as science was called into question. And so now if I'm learning, be it social media, news, or internet, and I have questions and I come in and there's any kind of disagreement or difficulty in the conversation, if we don't have a good, well-established relationship, it can create a divide. And so from our perspective, lots of work to be done of just one simple thing: listening more, paying attention, hearing what the patients are really saying, and make sure they understand what they're saying is important, and we want to help get them to the best care possible.
Thank you. So how does osteopathic medicine and the osteopathic physician fit into the solution of these issues?
Back to that, what is osteopathic medicine? The beauty is that, especially around the primary care piece first, our mindset, our approach to education definitely supports the alignment to primary care. And we see that in our graduates. So one, if you look at the mission statements, if you were to go one by one through our colleges of osteopathic medicine, you would find an incredibly high percentage that primary care is in their mission. So students come through the door, they know what they're going to get exposed to. We try to put the right role models in front of them and the right messages so that they see that as a great pathway to practice. Not discouraging specialties, but emphasizing the importance of primary care. At graduation, when you look at the matches into residencies, there's an effect because for a long time, we've been north of 50% of our graduates are entering into the three primary care fields. So the pediatrics, internal medicine, and family medicine. Mm-hmm. And then if you look downstream at some of the big national reports, you will see in the top 10, best medical schools, typically the osteopathic schools in terms of producing primary care physicians, practicing in rural areas and practicing in underserved areas. So we think the model does a great job and it aligns to our philosophy to support that. As far as distrust, mistrust, erosion of trust, the biggest thing there, part of that philosophy is about understanding the importance of the human connection and deep listening. And so creating that relationship that's important for healing to occur.
Wow, that's quite an explanation. Thank you so much for that. Are there any other questions I haven't asked? What's a message that you'd like to get out to people as we end this?
Well, I do want to make sure that they're aware of our website, aacom.org,
yes,
because they're going to find plenty of information there about osteopathic medicine and osteopathic medical education. But I think the key, and in your question, we think that our way of practicing medicine aligns really well with the needs of the healthcare system today and with what patients are actually looking for in a physician. So hopefully, if they take a look and what they might hear today, it might be a pathway for them to find health.
Great. Thank you so much. So glad to have you with us today. Thanks for being here.
Thank you. Appreciate it.
So we've been talking with Robert Cain, DO. He's the president and chief executive officer of the American Association of Colleges of Osteopathic Medicine. And you can learn more about them at aacom.org. Before this position, he served as the associate dean for clinical education at the Ohio University Heritage College of Osteopathic Medicine. Remember, you can subscribe to us at gotohealthmedia.com so you don't miss a show. And you can also watch us on YouTube and listen to us on 8 podcast networks. Visit our online store at gotohealthmedia.com/store, where you can enjoy GoToHealth and I Support evidence-based medicine swag. We'll see you again next time. Remember, as we say at the end of every show, go to health. Take care. Have a great week. Bye-bye. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.